Dr. Hawary, let's talk one method of teeth replacement, and you have mentioned it a little bit. There is that a partial or removable partial, which also can be a full denture. So let's talk dentures. And let me actually tell you something I have heard lately, and you tell me what you think about it. I've heard that there's lots of people out there who have denture creams, adhesives, to glue their denture on it, basically, especially when they become loose. And dentures always become loose after a while, not because the denture gets bad, but because the bones are shrinking. It's not like a bad shoe. The shoe becomes more loose. That's the shoe which gives. This is the other way around. It's not the denture which gives, it's the bones. A bad thing, but that's a topic for a different area. So, but there have been some people, there's controversy out there on the news, has been on the news that those adhesives seem to be having too much zinc in it, and even though zinc is a good thing, but if in excess, those people get basically poisoned, they get nerve damage. Some people apparently have the nerve damage is so big that they're in the wheelchair and mentally handicapped. They're typically like this type of thing a little bit. It's not proven, and the companies who make these adhesives are changing with no doubt, and that's wonderful. The fact is, however, that there's a way to eliminate that whole thing at all by what I call a hybrid denture. Put a few implants in it, snap the denture on it, and apparently it works very well. Anyway, give us your take on number one, the adhesive, and what should people do. And personally, I think, why would anybody want to run around with glue in his mouth? And on the implant dentures, are implant dentures really as good as people say?
Well, absolutely. I think implant-supported dentures today is, I think, the standard of care in the 21st century, because having things like what you said, regular dentures, there would be a lot of bone resorption, and the dentures will get loose, and it makes it hard to speak, hard to eat, and more embarrassing, and people will become much more self-conscious about it. And as you mentioned, they start using creams and denture adhesives, which has a lot of chemicals. Anything artificial, anything with a lot of chemicals in your body, in your mouth, you're swallowing all of that. There are a lot of potential problems coming from that, as you mentioned. Now,
well, especially since you have talked about gum disease, and the gum is the gateway. It's the most open blood vessels to the blood vessels you have. They're very open. You know, skin here, it takes quite a bit to go through, but in the gum, it just sucks it in it. So if you have this glue, and any glue gotta have chemicals in it, and you constantly have them in that mouth, never mind the discomfort, which, thanks God, I've never had to experience it yet, but just thinking of having those chemicals in it, they must be doing some damage.
Beside the fact that the extreme inconvenience, if you remove that, then you have to put the denture adhesive again, the taste, the messiness, all of that combined, it's a lot of a big ordeal for people that have dentures, versus
I don't hear you, doctor. I lost your sound.
Hello?
Yeah, now I hear you again. Okay.
Where we
just say versus, they're putting that stuff in it, and then versus...
Versus a mechanical retention provided by the implants. It's a new era where the implant-supported dentures become anchored to those implants. So there's extreme stability in the denture. People can bite an apple again and not
Really?
get
So
absolutely.
You can bite an apple again, because I mean there are people out there who have problem biting an apple even with their normal teeth.
Oh, absolutely. I mean, if dentures are very strong, if you have enough numbers of implants supporting the dentures, it becomes almost a fixed restoration that snaps into those implants, and patients can eat a steak, can eat an apple, can bite on hard things. They won't be embarrassed to have something coming out of their mouth or move. And more important as well, as we mentioned, it preserves the bone, because one of the worst thing about dentures, as the denture is putting all the pressure on the gum and the bone resorbs, and that's why dentures get loose. But if we have an implant-supported denture where all the pressure is going into those implants, we preserve the bone everywhere, and that's another very big advantage of having the implants supporting the denture versus all the pressure going to the gum and the bone.
Wonderful. And what about the taste? Because a denture, especially on the top where the palate is, it has this plastic or this metal, and you really can't, because most of the taste, I'm a gourmet kind of person, most of the taste is really coming from your palate, not so much from your tongue. And how about that?
Yes, absolutely. When you have an implant-supported denture, you don't need the retention of the palate. You don't need a large surface area. It's not an adhesion anymore between the denture and the gum through the saliva. It's merely a mechanical retention through the denture and the implants, where it snaps into certain male and female kind of attachments like locators and all kind of things in the market, where the denture snaps mechanically to those implants. So we don't need all that coverage of the palate that obstruct the salivary glands and the taste buds, and will have a much more natural feel. When you eat the food, you will feel the temperature more, and you as well can taste the food better.
Beautiful. Absolutely gorgeous. Now, one last question. A person is out there, and apparently are 30-some million people in America who have a denture, and he kind of like hears what we were talking about, or he hears on television all the stuff going on about the denture creams. Either way, he's getting sick and tired of putting glue on and taking it in and out and feeling uncomfortable. But his dentures are in pretty good shape. Is it possible, does he need to throw them away and buy new dentures, or can he, in some cases or in all cases, keep the old denture and doesn't have to spend the money for making new dentures anymore?
You mean if implants were being placed, does he need to use the same denture? Absolutely. If there is, again, if it's worth it, because sometimes old dentures have a lot of wear in their teeth and have a lot of other hidden problems, but assuming that the denture is great and he's very happy with it and it can be utilized, there is no need to change the dentures and put the money into the dentures. We can use that towards the implants and connect the denture to the implants via creating some spaces, and we put some female attachments into those dentures, the old ones, and put the male attachment into the.
So you can use the old dentures if they are still in good shape, if the patient is happy. Thank you very much for your candidness, Dr. Hawary. Appreciate it. Bye bye.